Hey everyone, Josh Guttman here from POCUS, back with another device review. I'm really excited about this one because today I'm finally reviewing a Clarius ultrasound device. And Clarius is one of the most well-known handheld ultrasound companies on the market, and I've been looking forward to getting my hands on this and actually using it in real clinical practice. Today I'll be reviewing the Clarius PAL HD3, including some of the newer AI features that were recently released. Now, many of you probably already recognize the name Clarius. They're a Canadian company, which is dear to my heart as a Canadian, and it's been around since 2016, and they've built a strong reputation, especially in the musculoskeletal ultrasound space. But this is definitely not a one-trick device. It's designed to be a true, all-purpose, universal probe. Now, this review is sponsored by Clarius. That said, as always, this is a fully independent review. They have no control over the content of this video or my opinions. The Clarius PAL HD3 is a wireless, single universal probe solution, meaning you can perform the curvilinear, phased array, and linear imaging all in one device. And that is a big deal from a portability standpoint. Now, one thing you'll notice right away is the wider footprint, which is advantageous when imaging deeper structures, but can make cardiac scanning a little bit more difficult. In terms of size and weight, this was on the heavier side and is a little harder to really cradle in my hand, but in real clinical use, it honestly didn't matter. I was carrying it around the ED in what I call my scanny pack, moving room to room, and the weight never became a limiting factor. So let's talk about some of the practical day-to-day concerns, especially with wireless ultrasound devices, and see how Clarius measures up. So one issue is heat buildup. I specifically paid attention to this, and in real clinical scanning, I didn't run into any meaningfully overheating issues. And battery life was also very good. I was generally able to go a full shift with an average amount of scanning for me, which is a lot of scanning, on a single charge. The charging setup is also well thought out. There's a dock-based charging system, which makes it really easy to integrate into the workflow. When I didn't need to charge it during shift, I would just plug the dock in and set the probe in between patients and keep going. No cables directly into the probe, no interruptions, just seamlessly charging as you move through the day, just sticking it on the charging station. Now, the thing that really stands out compared with other devices is the AI functionality, especially for learners. Clarius has recently rolled out several AI-driven features, and this is clearly a major focus for them. These tools are especially helpful for clinicians who are earlier in their ultrasound experience. They help with anatomy recognition and visualization, essentially guiding you in real time. But even for more experienced users, there is utility. And one feature that stood out to me was the AI-based ejection fraction calculation. And what's unique about the Clarius EF calculation is that it works across all the cardiac views. So many devices limit the EF calculations to just one or two views, typically the apical floor chamber or parasternal long axis, but here you can calculate the EF across multiple views, which adds flexibility and true practicality in real-world scanning. Now let me show you the device a bit more up close. So here you can see the probe itself. Here is the probe head. You have the probe marker on the side as a small kind of light over here, which once you turn on the probe, as you press the on button, it'll light up so you can see exactly where the probe marker is. And again, here's the charging station that you can just dock in. So let's see how it looks when you turn on the device and what it looks like on the app and how long it takes to load. First thing I'm going to do is hold the on button right there. Then I'm going to open the app. It's going to establish a secure connection. The blue light's turning on, so it's connecting. Join the Wi-Fi. And there it is. It's green, flashing, and connected. Okay, so this is what it looks like when you turn on the screen. It's nice and clean. At the top, you can choose which preset you're going to use. So abdomen, cardiac, etc., all the way through. If you had different Clarius scanners, you can use those different ones. Then at the bottom, you have your freeze button. On the bottom right with that camera, you can take an image and you can take a clip right there. And then moving along in that B below, standing for B mode, you can then change to various different modes, and there's different tools from zoom, focus. You can split your images and change between B mode, M mode, for example, color Doppler, whatever it is. It even has elastography built in, which is definitely unique when it comes to the handheld devices. And then you have your measurement tools on the side, which includes voice control, which is great for procedures, and then your volume and distance. You can use pictograms to put a pictogram on your screen if you would like. And then application specific, you can put some different labels on right, left, etc. Here's back to generic one. You can annotate if you wanted. You can either use a preset or type in anything you like. Increasing the gain is very easy by swiping left and right. When I change the gain, you can see that there's that A on the side that comes up, and that's auto gain. So it will auto gain for you. And the B button is where you can change the gain on your own. The auto gain feature works really well, so I tended to just use that. And then the depth is just up and down. It's very clean. If we go into the different settings, so if you're going in to start scanning, on the top right, you can see that you can grab it from a work list, so it works really well into the encounter-based workflow. If you wanted to bring in a patient in just via barcode scanner, where it says to patient ID, you can press on that barcode scanner, and then you could put that in that way. So that makes it really nice, especially if you're scanning from your phone. Again, making it really well done for encounter-based workflow. And then you can have some images. Here's the ones we just saved, which are there below, which helps for your report, which you can put in right from here. The side menu, what's really nice is your classroom, and it has a lot of different videos that you can watch for a lot of various ultrasound exams. So for the new learner, they can watch something before scanning. That education built right into the app itself. You have the settings over here, which allows you to change the cine length, auto capture, connect, etc., auto freeze. Let's start with the abdominal scanning. So here's if I was performing a fast exam. You have the right upper quadrant view. Over here, you have the kidney and the liver. So here's what that looks like on the abdominal preset. There's also the fast preset. So fast view is pretty similar. That's what the left upper quadrant looks like. There's a gallbladder. You can zoom in on that short axis of the gallbladder. We're going to freeze and measure the gallbladder wall to show you what that would look like. It's a distance. And you can actually put your finger right inside that blue circle so you can see exactly where your distance is, so you're not blocking the calipers with your finger. 2.5. And you can save that if you wanted to, and it'll actually remind you. In the bottom right corner, you can see that's flashing. The bottom, and that actually was quite helpful. There you go, saved. Let's move over to bladder scanning. Nice full bladder, quite easily seen over here in long axis and short axis. And if you're going to go ahead and get a volume, you can easily do that. You go to measure. You can get it done with AI, which I'll show you now. You can look at bladder pre-void and bladder post-void. So I'm going to press on the AI one so you can see it. So it captures the whole bladder. And once you freeze it, it gives you the measurements in the transverse view. You could save that. And you can unfreeze and go into the sagittal view. You can freeze, and then it gives you a volume, as you can see right there. So that's pretty neat, and then you can save it. Let's get out of the AI, and now let's try that bladder volume manually. They give you the height. They give you the length. I can go ahead and save that, unfreeze, and there's the sagittal view. And then that was a little short for me, but about 176. So you can do it manually. Go on to cardiac scanning. So you have cardiac up here, you have basic and advanced. And so what you'll notice here is that instead of just the B on the bottom, you have that extra T. And the T is the AI training mode. And so I'll show you what that looks like when you turn it on. But first, just going to regular B mode. First, long axis view. So you can see that despite it being large form factor, you still get a nice cardiac view, and I traditionally have a very difficult external long axis view. Now go into the teaching mode, and look how cool this is. It overlays with color exactly what I'm looking at. And even though the RV is barely in the corner, as you can still see it, it tells you what the free walls are, the LV, all the different structures. So if you're learning and you're like, I don't know what this is, then it's right there. And even if I move over a little bit, it adjusts. So you see that's even better, and it adjusts. So that's really cool. And so that's T mode. And then we can go back to 2D regular mode. And now I want to show you the ejection fraction. So it reads that wall. So you have to wait a second. It gives you that injection fraction there, and it can read that it's in the long axis, and the green means it's a good view. I'm going to show you the T mode and short axis, where now it can see the ELV, the interventricular septum, the RV, so it can tell you exactly what you're looking at above. And again, as I moved, there's a much better view. And so it can see the papillary muscles, but it sees the papillary muscles and the mitral valve because they both come in and out. As I change the angle, it'll show you what comes in, so it's really sensitive at showing those things. And you can actually save this entire image with this overlay as well. Go back to 2D, view the EF. Oh, I had it for a second. In fact, in clinical practice, I actually found their short axis to be much better. Let's get the apical 4-chamber view. So here's a nice apical 4-chamber view. Now let's take a look at what that looks like on the T mode, on the training mode. You can see the free wall and everything labeled nicely, or the RV's labeled with blue and the LV's labeled with red. And so that's pretty cool. Definitely good for anatomical marking for training, especially if you can't remember which ones are the atria and which ones are the ventricles and which side is what. Check out the EF in the apical 4, apical 5-chamber view. Let's check out the color while we're in this view. So that's what that looks like. You can change the sector size and color. You can always change to pulse wave Doppler. Pretty nice. And save that. Now, musculoskeletal, which is from a learning standpoint, is one of the areas where it really shines. Let's start with the knee. So you can see that it's got that T right at the bottom. So you know there's going to be some AI. So let's go to the knee and see how it looks. There's the patella over here and the quad tendon right there at the front of the screen, which you can see really nicely. And when you look at the T mode, this is cool. I haven't seen any other ultrasound that can do this. It tells you exactly what you're looking at. You can see cartilage, fat, subcutaneous tissue, bone, like exactly what you're looking at. And as you slide over, you can even follow the tendon, and then it moves with it. If I go over to the patellar side, you can see the tendon and it gets right to the bone, and you can see the insertion right here lit up. So this is ridiculously cool, I have to say. So let's go down to the Achilles. There's no T mode for the Achilles, that just has you regular MSK, but you can really see how nicely it images the tendon. So I think it really shines in the musculoskeletal. The shoulder also has some T mode. Here you have my shoulder and my supraspinatus in there. If I turn on the T mode, it's so good that it tells you where my muscle is because it's looking in the shoulder. And definitely, if there was a rupture, you'd be able to see it. As I change positions, it moves right around. The HH is the humeral head down there. And so it has several features just like that. This is what lung looks like in the lung preset. I'm much more of an abdominal preset fan. So there's the abdominal preset. It actually has an auto select feature. So if you change, it'll actually change for you. So there you can see that it knew it was in the lung. So it changed to the lung preset. Let's move on to some of the vascular scanning. Here's up in the neck. There's a carotid. And below, the IJ that's going to come up. And some thyroid imaging. Here's the left lobe right there. And for nerves, you can see the median nerve right in the middle there, which looks really nice and clean. Let's get into some of the pathology. Here's the Clarius PAL HD3, looking at a heart dilated cardiomyopathy with significant systolic dysfunction. And you can see the walls nicely here with the heart not squeezing well. The mitral valves are not slapping the septum well, indicative of someone with severe systolic dysfunction. So you can see that really well. Let's look at that on the training mode. And if you look at the bottom of the screen with the training mode here, you can see how big the LV is. And in color, you can see that the mitral valves are not moving well. So you can even just look at this bottom screen in the training mode and have all the anatomy highlighted, and it's in real life proportions. And so when you saw the normal with a normal LV and normal LV contractility, you can see even with the pathology, it labels everything very well, including the small aortic valve over here, and be able to even just tell that this heart isn't squeezing. Let's look at it on some other views. Here's the parasternal short axis view with poor ejection fraction, and may even have some lateral wall motion abnormality, but very poor systolic dysfunction. On the T mode, here's what you can see, that the LV is big and not squeezing super well. And you can see that the mitral valves come in, and even some of the papillary muscle which come into view, if you look carefully at the very end, is very easy to see prominently, and it's labeled on the T mode. In the apical four-chamber view, you see nicely with also poor systolic dysfunction. And on the T mode, you can see that as well. So you can see that for training purposes, and if you're not used to looking at an ultrasound screen in the gray and white, looking at it on the training mode really helps solidify what you're learning in a course. Here's the subxiphoid view. And with the subxiphoid, it can be a little bit more difficult with the large probe head form factor to get a good view, but you can see that in many patients, you can still get what you need. And then in the T mode, you can see that it's pointing out the chambers very nicely. You can see that the LV is bigger than the RV. Over here, that sneaks in. You have the RA and the LA and the different walls over there. So it also, what's cool is that it could just tell what view you're in, and it knows you're in a subxiphoid. I found I used the T mode a fair amount of time to test it out, and it's actually quite accurate, very impressively. Here's the parasternal long axis view again with some slight mitral regurgitation. You can see right there, you can see that blue turbulent flow backwards. And so this is just really to point out the quality of the color to see some of that regurgitant effects. When that same patient who might have a systolic dysfunction and the congestive heart failure, you might see pulmonary edema. And here's B lines that you can see nice and prominently on the lung mode. Here's another example of lung ultrasound, and you can see the B lines well enough to make a diagnosis. Switching to abdomen, here is a patient with cholecystitis. You can see the stone here in the gallbladder neck with the posterior acoustic shadowing. And then you can see up here that there's a thickened wall that's in short axis. You can see the sludge and stones mix in here. And if you look at the wall, it appears really thick. And here it is measured at about 1 centimeter. This patient went to the OR for acute cholecystitis, diagnosed on point of care ultrasound. Here is a patient with a small bowel obstruction, and I'm going to pause it, and you can see the bowel wall over here. Here's the plecus circularis, that you know it's a small bowel, and you can see that it's dilated and that you have to and fro peristalsis coming through the bowel over there. That's one of the secondary signs. And then this is just one example of measurement. Normal should be under 2.5 centimeters, and this is 4.5 centimeters as measuring the bowel wall. This was a patient who had a high-grade obstruction and ended up going to the operating room for bowel obstruction. Here's an example of a patient with urinary retention. You can see how, even without measuring the bladder, how big it is. It has got a little bit of a thickened bladder wall, and you can see the prostate coming in and out, which was the cause of this patient's urinary retention. Now, to get into the procedural, this is a patient who had a laceration to the plantar surface of the foot. And this is where I'm performing a posterior tibial nerve block. Here's the nerve that you can see really nicely, the posterior tibial nerve. And then you can see guiding the needle right next to the nerve, and you can see the needle along axis. So this also works well for procedural purposes. So let's wrap it up. Overall, the PAL HD3 is a really strong entry into the handheld ultrasound space, and it stands out in a few key ways. AI integration is excellent, especially for early learners. So if you're early in your POCUS journey, this is a tool that can actively help you learn while you scan, guiding an anatomy and reinforcing what you're seeing and building confidence in real time. And second, the charging workflow is just very practical and really nice. The dock-based system makes it easy to keep the transducer powered throughout a shift without interrupting your workflow. It's one of those small things that actually makes a big difference in the day-to-day. Overall, it's a device that really leans into being both a clinical and an educational tool with these new AI features, which is a great combination for new users. Now, if you're trying to figure out whether this is the right handheld for you or how it compares to other devices, that's honestly where most people get stuck. If you want help with that decision, I do offer personalized handheld ultrasound consults through Peachtree POCUS to help match you with the right device based on how you actually practice. And you can check that out at peachtreepocus.com/handheld. And if you're looking to build not just device confidence, but real bedside ultrasound skills, I also run a hands-on POCUS course called POCUS Kickstart Live here in Atlanta, Georgia. It's focused on practical scanning, and you can immediately apply it in your clinical practice. You can register and learn more at peachtreepocus.com/kickstart. As always, thanks for watching, and I'll see you on the next video.